Today I'm going to tell you about our project, as Brian said, IHS Workforce Development and Going Lean to Understand Needs. So this is Morgan on your left. She's a registered nurse at the Chittimacha Health Clinic, which is in rural Louisiana, where she's developing a new tobacco cessation program. And this is why tobacco cessation is important to Morgan and the community she serves. American Indians and Alaska Natives have the highest rate of smoking among all ethnic groups in America. So what does she do? She goes online for resources, and then she's quickly overwhelmed by the amount of information that she finds. So how does she find the relevant material? Well, she contacts Max, and Max is our health promotion and disease prevention coordinator, and so she contacts him for some guidance. And certainly Max is pleased to get this call because tobacco cessation is a priority area for the Nashville area. So he directs her to several online resources that he knows other tribal programs have used in the past to get started. So this story of Morgan and Max is kind of how we currently do things. There's also a couple problems with this process. Back up just a moment, in the Nashville area of the Indian Health Service, we have professionals working in small, rural, and tribal and federal facilities that are scattered across the eastern half of the U.S. So when these professionals seek out information, the problem is not that they can't find information, it's that there's just too much of it out there. So how do they get through the noise, and how do they know what will be most useful to them in their setting? I also want to be clear about this, about our customers. They are frontline staff, they're clinical folks, they're public health professionals, and engineers are providing care to tribal communities. And again, they work for federal, tribal, and urban programs. And so we need to provide them with the tools and training that has value to them and in an efficient way. So to do that, we need to be able to listen to them. So let's go back to Max for just a moment. So Max and the rest of us in the area office, we have a related problem. When we want to focus attention on a priority health area, how do we get the information and material to people in the field, and how can we make sure the information that we provide is useful to them? So Morgan, she solved her problem, right? She contacted Max, but how do we scale Max? How does Max get systematic feedback from Morgan on the material that he recommended to her? So our solution is to engage IHS staff in reviewing and rating the educational material, and to ask our colleagues in the field to help us identify the training and material that are most useful to them. And we think there's already a readily available web-based application out there to do this. So here's how we set about to do our project. We conducted a series of interviews with users so we can better understand the problem. And based on their feedback, we created a paper mock-up of a website. In fact, I'd say that they designed the mock-up. We just kind of listened to what they had to say and then went back and designed the mock-up and then iterated the mock-up. So now we have a viable solution to build a prototype that will engage the staff in rating and reviewing the material. So we learned a lot along the way. We learned to think in terms of identifying the minimum viable product and rapid iteration. So in our situation, it was a paper prototype, a website paper prototype. So we learned to engage users early and often and to build their feedback into the product development cycle. So we also learned if you start with a web developer, you have a good way of getting nowhere fast while spending money getting there. So we'll move our paper prototype onto the web in its environment, still thinking in terms of a minimum viable product, and pilot test with a small group of users and a narrow focus of topics. So I want to ask you today, just help us out, help us build this amazing system of 15,000 staff that are serving over 1.5 million patients.
Awesome. Thank you.
I was going to say, you used smoking cessation as your example there.
Yes.
Is there a measurement as to the value of the reduction in smoking cessation that your payer knows about? So could you track this and say, if we can reduce smoking cessation by X percent, what's the dollar value of that?
The dollar value of that? That's a good question. And I'm not sure, I don't have a good answer for the dollar value of
I think, like, from an investment point of view,
Okay.
you know, $50,000 investment, if you could create, you know, $500,000 or more of dollar value that you could measure on scale, I think that would be the right way to, as a next step, to try and get
Okay.
investment.
And
So
we
excellent,
can help
yeah.
you.
Okay, all right.
Sorry, go ahead.
One of the things that I was interested in, I mean, I think it was great to see that our materials did well. Is it possible to get the feedback on the effectiveness of the training or of the information as a function of either the sector who's using it or the type of settings that it's being used in? I would imagine that would be useful to whoever is producing that material. And then also to provide feedback in case you have a particular sector that is not doing well, and then we, for example, can make it better for you.
Right. So in our case, we're going to try and curate material that focuses on tribal communities. So we're going to start with IHS and our region at first, and we're going to put material out there that we think is great, and then have them say, okay, thumbs up, thumbs down, and then the process will kind of evolve from there.
And will you provide that feedback to whoever originated that material, who designed the material?
Exactly.
Okay.
Yeah, they could go back to the site and say, okay, this is what people are saying about it.
John, just as a former entrepreneur myself, I was thrilled when I saw your project even had the word lean in the title. And with the whole concept with lean, as you've learned, is really focusing on that problem need identification. And I really love that you embraced a lot of the methodology, the low-res paper prototypes. A lot of people like to jump in and build the website first and find out after the fact it didn't really address some of the things they did. So I really like that you did that. I would actually encourage you to continue doing more customer discovery, because I think one of the things you said was, how do we scale Max, and maybe even a little bit of customer discovery on, is that what the people find? Is Max the ideal embodiment for everybody you're trying to reach? Maybe for a segment, maybe it's Max, maybe for a different segment it's Maxine, or maybe something completely different. So I would just encourage you to explore that.
Okay, thank you.